Type 2 diabetes is a chronic condition that affects millions of people worldwide. It occurs when the body becomes resistant to insulin or doesn't produce enough insulin to maintain normal blood sugar levels. While lifestyle changes such as diet and exercise are crucial for managing type 2 diabetes, medications also play a vital role in controlling blood sugar levels. In this guide, we will explore the different types of medications used in the treatment of type 2 diabetes, their role in managing the condition, and their benefits and potential side effects. Insulin therapy. Insulin therapy is a common treatment option for people with type 2 diabetes who are unable to control their blood sugar levels through lifestyle changes and oral medications alone. Insulin is a hormone that helps regulate blood sugar levels by facilitating the absorption of glucose into cells. There are different types of insulin available, ranging from rapid-acting to long-acting. The type of insulin prescribed will depend on individual needs and preferences. Insulin can be administered through injections or insulin pumps. Insulin therapy is typically recommended for people with type 2 diabetes who have high blood sugar levels or have difficulty achieving target blood sugar goals with other medications. It is important to work closely with a healthcare provider to determine the appropriate insulin regimen and dosage. Oral hypoglycemic agents. In addition to insulin therapy, oral hypoglycemic agents, OHAs, are commonly prescribed to manage type 2 diabetes. OHAs are medications that are taken orally and help lower blood sugar levels. They work by increasing insulin secretion, reducing insulin resistance, or slowing down the absorption of glucose from the digestive system. There are several classes of oral hypoglycemic agents, including sulfonylureas, biguanides, thiazolidinedionase, DPP-4 inhibitors, and SGLT2 inhibitors. Each class of medication works in a different way to help control blood sugar levels. It is important to note that OHAs are not effective for everyone with type 2 diabetes. Some individuals may require insulin therapy or a combination of both insulin and oral medications to achieve optimal blood sugar control. Diabetes drug classes. Type 2 diabetes medications are classified into different drug classes based on their mechanism of action. Understanding these drug classes can help healthcare providers tailor treatment plans to individual needs. Some commonly used diabetes drug classes include sulfonylureas. These medications stimulate the pancreas to produce more insulin. Biguanides. Metformin is the most commonly prescribed biguanide. It works by reducing glucose production in the liver and improving insulin sensitivity. Thiazolidinedionase. These medications help improve insulin sensitivity in fat and muscle cells. DPP-4 inhibitors. DPP-4 inhibitors work by blocking the enzyme that breaks down incretin hormones, which help regulate blood sugar levels. GLP-1 receptor agonists. These medications mimic the action of incretin hormones, helping to increase insulin secretion and decrease glucagon production. Each drug class has its benefits and potential side effects, and the choice of medication will depend on factors such as individual response, tolerability, and the presence of other medical conditions. Metformin treatment. Metformin is often considered the first-line medication for the treatment of type 2 diabetes. It is a biguanide that works by decreasing glucose production in the liver and improving insulin sensitivity in muscle cells. Metformin is typically well tolerated and has a low risk of causing low blood sugar levels. It is usually taken with meals to minimize gastrointestinal side effects such as diarrhea and stomach upset. In addition to its glucose-lowering effects, metformin has been shown to have potential benefits on cardiovascular health, weight management, and reducing the risk of certain complications associated with type 2 diabetes. It is important to follow the prescribed dosage and monitor blood sugar levels regularly when taking metformin. Any concerns or side effects should be discussed with a healthcare provider. Anti-diabetic drugs. Anti-diabetic drugs are medications specifically designed to lower blood sugar levels in individuals with type 2 diabetes. They can be used in combination with other medications or as monotherapy. Anti-diabetic drugs work by targeting various aspects of glucose metabolism, such as insulin secretion, insulin resistance, and glucose absorption. By controlling these processes, these medications help regulate blood sugar levels and prevent complications associated with diabetes. It is important to work closely with a healthcare provider to determine the most appropriate anti-diabetic drug or combination of drugs for each individual. Medication management for diabetes. Medication management is a crucial aspect of diabetes treatment. It involves working closely with healthcare providers to ensure that medications are taken as prescribed, monitored for effectiveness and side effects, and adjusted as needed. A comprehensive medication management plan may include regular blood sugar monitoring, medication adjustment based on blood sugar levels, regular follow-up visits with healthcare providers, and education on proper medication use and storage. It is important for individuals with type 2 diabetes to actively participate in their medication management and communicate any concerns or difficulties to their healthcare team. This collaboration helps to optimize treatment outcomes and minimize the risk of complications. Conclusion: medications play a crucial role in the management of type 2 diabetes. Insulin therapy and oral hypoglycemic agents are commonly used to control blood sugar levels and prevent complications associated with the condition. Understanding the different diabetes drug classes, such as sulfonylureas, biguanides, thiazolidinedionase, DPP-4 inhibitors, and GLP-1 receptor agonists, can help healthcare providers tailor treatment plans to individual needs. Metformin is often considered the first-line medication for type 2 diabetes due to its effectiveness, tolerability, and potential benefits on cardiovascular health. Anti-diabetic drugs are designed to target various aspects of glucose metabolism and help regulate blood sugar levels. Medication management is crucial for optimizing treatment outcomes and minimizing the risk of complications. Regular communication with healthcare providers and active participation in medication management are key to successful diabetes treatment. By understanding the role of medications in type 2 diabetes treatment and working closely with healthcare providers, individuals with type 2 diabetes can achieve optimal blood sugar control and improve their overall health and well-being.